So now let's talk about the treatment for this condition, the cherry eye. We have two ways of doing this. We have the medical management and we have the surgical repair. Now, for the medical management, it can only be used when we have an early, a mild case of cherry eye. We can prescribe some topical anti-inflammatory drugs, but therapy alone for this condition is rarely enough. And long-term, the surgical management of this condition is preferred. Now let's talk about the surgical repair, the surgical option for the cherry eye. The preferred treatment is the surgical repositioning of the gland. We should never remove the gland. In the past, that was the solution. We excised and removed the gland. But now we know that this approach greatly increases the risk of dry eye. We know now that the gland plays an important role in the tear production, and we should never just remove it. What are the options? Well, there is two options again for the surgical approach. We have the pocket technique and the anchoring technique. For the pocket technique, basically, we create a small pocket in the inner part of the membrane and we put the gland inside. So it's creating a little house and we close it with absorbable sutures so the gland stays behind the third eyelid. The second surgical option is the anchoring method. This means we will take the gland and we will anchor it. We will use sutures. We will suture it to orbital tissues, for example, the periostal tissues. In this way, it will maintain the gland in position. We don't use this technique in all dogs, but some dogs are more predisposed to forms of cherry eyes that respond better, and these dogs have a high risk of reoccurrence if we only use the pocket technique. So we put the two techniques together to have the best results. It is important to note that with this combination of techniques, with the techniques that we choose depending on the presentation and the breed, we usually have a 95% chance that this gland will stay in place and will not come back. There is, unfortunately, no technique that ensures 100% chance that the gland will not resurface, will not reprolapse. But with these techniques, we have a very, very low chance of reoccurrence.